Hello everyone, I am Dr. Sreedhara, consultant neonatologist at pediatrician at Rainbow Children's Hospital, Hebbal, Bangalore. The two things are happening around the corner now. One, the monsoon has arrived. Second, the schools are restarting. So this is the time when many children start developing infections which are very common during this season of the year. Most of the times it is a respiratory tract infection, commonly called flu-like illness, wherein kids present with fever, cough, cold and other respiratory symptoms. We call it as flu-like illness because influenza viruses are the most common reason for this. However, there are many other viruses which present with similar symptoms and they cannot be differentiated from flu caused by influenza viruses. Now let us see how to manage these kids at home. Fever is the most predominant symptom and it can be effectively managed at home with paracetamol. The dose depends on the weight of the child and it can be repeated every 4 to 6 hours. We can also sponge these children with warm water, especially half an hour after giving paracetamol. If the temperature is still high and the child is feeling uncomfortable, they can be sponged with warm water. And this should not be done if the child is shivering because it's only going to worsen the problem. It's also very important to maintain good hydration because unless the kid is well hydrated, your paracetamol is not going to have an effect on the fever. Rarely, there are other medications such as ibuprofen which can be used when there is high degree of fever which is not responding to paracetamol or tepid sponging. But this is not routinely indicated and should be done after consulting with your pediatrician only. The other two important symptoms are cough and cold. Cold in the sense running nose, nose block, nasal discharge. So for running nose, mild running nose, no medications are necessary. But if there is a lot of watery discharge and sneezing and the child is uncomfortable, antihistamines can be used after the age of 6 months only. The dose and choice of these medications should be decided based on the child's weight and age, and it's better to consult with your pediatrician for the same. For cough, generally, there's always debate whether cough syrups are useful or not. But mild cough can be managed without any cough syrups. Home remedies are very useful. For example, in kids with repeated bouts of cough, just sips of warm water is useful. And in children who are older than 1 year, honey is useful. You can give 1 spoon 2 to 3 times a day. Steam inhalation with proper precautions because small children with hot water nearby, you should be careful. So steam inhalation for 5 to 10 minutes just with plain water 2 to 3 times a day are also useful. And some of the home remedies that are frequently tried for cough can also be tried in these children. Now the indications for you to definitely take the child to your doctor would be fever persisting beyond 3 to 4 days or severe cough, especially when you have noticed fast breathing, chest indrawing, the child is struggling to breathe, or if the child is very dull, there's poor oral intake and the urine output is less frequently than once in 4 to 6 hours. These are the indications for you to take your child to the hospital. And generally what happens is most of these children recover with just paracetamol and other symptomatic therapy. Fever reduces in about 3 to 5 days time. However, cough, cold can be prolonged. They can go on for up to 7 to 10 days. So if the symptoms are either severe or if they are prolonged, you could take these children to the hospital. Thank you.